Could get the PowerPoints going.
I have it. Hi, everybody.
Hello. Got some people coming in.
As everybody's coming in, if they want to put in the chat box where they're from. We'll be starting in a few minutes. I see we have Michigan, Oregon, Wisconsin, oh, and I see several more questions. So if everybody has questions, there is a Q&A box for questions. I'll go through the ones that are in the chat as well, but you can put questions in the Q&A box. I'll just give it another few moments here. So far we have 16 participants. All right, I think we're going to get started now. So I'd like to just introduce myself. I'm Josephine Griemer. I'm the Chief Science Officer for the Marfan Foundation. I also like to introduce my colleague who will be helping me here tonight, Bruno De Salva. He's our program manager for many of our programs that we host at the foundation. I want to welcome everybody to the third and final week of the E3 Summit, Educating, Empowering, and Enriching Our Community. It's being brought to you by the Marfan Foundation and its divisions, the Loeys-Dietz Syndrome Foundation and the VEDS Movement, and also by our partners in Europe, Vassern. We want to thank you so much for helping us make this summit truly historic. It's by far the foundation's largest event. We have almost 2,800 registrants from 72 different countries. And we've hoped that you've all had an opportunity to connect with people from all over the world in the app, and that you can maintain these connections after the summit. As you surely know now, you are not alone in this journey. And we really like to thank our presenting sponsors, Brigham and Women's Hospital and American Communication Construction. So before we start the presentation, I'd just like to note that the International E3 Summit is a forum to provide an open discussion of issues related to genetic, aortic, and vascular conditions. The opinions stated in each of the talks are those of the speakers and not necessarily those of the Marfan Foundation or VASCERN. So if any questions arise or clarifications are needed about differences in opinion between session speakers, please contact us on our website at marfan.org/E3Ask. So today, I really like to introduce our speaker. I have been working with Michael for quite some time, utilizing this Backpack Health app. And Michael, this is Michael Shapiro-Barr, and I'd just like to give him a chance to say hello to everybody.
Thanks, Joe. Hello, everyone. Thrilled to be a part of the International Summit. I think this is great to bring everybody together this way. I'm excited to share more about Backpack and happy to answer any questions that come up and explain a little bit more about this great partnership that we've formed with the foundation. So thank you.
Great. So as we go through the presentation, if you do have questions, you can put them in the Q&A box and we will try to answer as many questions as you can. Also, Michael will be available to answer any questions through Backpack, and they have a help center, and he'll describe that. So just one other thing, at the end of the session, we do hope to get your feedback on the session. So right in the app, there is a rate button, as you can see by the red arrow. So just press that and let us know what you thought about the session. So now I would like just to have the speakers turn off their videos and mute, and they'll play the
Hello everyone, I'm Michael Shapiro-Barr, Director of Business Development at Backpack Health, and today I'm going to tell you all about what Backpack Health is about. What is Backpack Health? Backpack Health is an app that makes it easy for individuals to manage, own, and share health information for themselves and their family members. Our app is entirely free to all individuals and their families, and we make it easy for you to bring all of your health information into one easy-to-use digital tool. Backpack is all about empowering patients and giving you the freedom to decide where you want your data to go and who you want to share it with. We're a family-focused tool, making it easy for you to control the information for yourself, but also allow you to add dependent profiles so that you can manage the information for kids, elderly parents, or other loved ones. Backpack is a multilingual tool available in English, Spanish, French, German, Italian, and Portuguese, with many more languages to come. Backpack Health is available on iOS, Android, and web, giving you the option to use the app and platform on any device you're comfortable with. With Backpack's Data Connections feature, you can easily link up to your patient portals, bringing in medical record information so that you can store everything centrally in your Backpack profile. Being able to quickly enter the information from your patient portal into your Backpack profile makes it easy for you to consolidate if you're logging into different patient portals, depending on the number of specialists you might be seeing, to really view all the information. Bringing that all central makes it very easy for patients. Backpack share cards are all about data mobility. Share cards allow users to securely share the information they choose with the people they choose to share it with. Every Backpack user receives an emergency and health history share card, but you can create a share card for any purpose, whether it's for a specific provider, a professional caregiver, a school nurse, a travel buddy, or anybody that you'd like to share the information with. Each share card can be shared in a variety of ways. It will have its own unique URL and access code that you can share with anybody, and they can then access that on their own device. or you can easily print out a PDF of the share card and make sure you have it with you at all times. Backpack Health can help you have critical information about your health ready in case of an emergency. You can easily take the URL and access code from your emergency share card and engrave it on medical jewelry, or you can use the app to create a custom wallpaper for your phone's lock screen. First responders can then view this information on a read-only web page on their own device without having to have a Backpack Health account. All information can be instantly translated to any of Backpack's supported languages with or without cell signal or Wi-Fi. We have some exciting new and upcoming features. You can now see your data charted over time to track and visualize important health information through graphs for measurements and labs. Coming soon, you'll be able to decide which symptoms and measurements you want to track on a regular basis. This can include things like blood pressure, pain, and other data points of interest, and you can then quickly enter information about them in the app. We've partnered with the Marfan Foundation to help support their mission, and we ask community members to join the Marfan and Related Conditions International Patient Registry. Together, we're focused on patient-driven research, giving you the chance to be a part of positive change. Patients are in full control of the information that you share with group administrators. Directly identifying information will never be made available. You can feel secure in knowing that any information that you share is shared safely and securely and is used for a good cause. You can continue to help by staying connected with the Foundation and participating in surveys and being able to access resources that the Foundation will provide for any group members. This includes things like emergency care instructions, which can easily be attached to an emergency share card, giving you additional information that you can provide for medical providers and first responders. Now is the time to get engaged as the Foundation gears up to launch a new series of short backpack surveys to learn more about Marfan and related conditions. Survey participation is essential as it will help to guide future research. The first survey in this new series will cover headaches, lower back pain, and dural ectasia. For any new or existing group members, don't forget to take the initial onboarding survey too, as that is very important in terms of taking next steps. If you haven't yet joined the Marfan and Related Conditions International Patient Registry, please join today. There are 2 easy ways to do so. You can open up the Backpack app and search for the Marfan and Related Conditions Registry under the Group section in the main menu on the left-hand side, or you can visit join.backpackhealth.com/Marfan Related Disorders Registry. As mentioned, Backpack Health is an entirely patient-driven system, and we love hearing from our users. If you have any questions, feedback, or ideas on how to make Backpack better, chat with us from within the app or email us at help@backpackhealth.com. Be sure to follow us on Facebook and Twitter to keep up with new features, and check out our Help Center for great how-to guides, tips, and tricks that will really help you get through and learn how to use Backpack in better ways. I'll close by encouraging everybody to please join the Marfan Registry. We are dedicated to supporting the Foundation and its community, helping to fuel innovation and research through patient-driven data. Thank you.
Now we'll take a look at be able to answer some questions. If you have questions, you can put them in the Q&A box. Let's see what has come in at this point. So, Michael, maybe you can help answer this question by Kathleen. She's asking, our local providers post scans and notes on Epic. Is there a way to transfer all the information there onto Backpack?
Sure. Good question. So right now through the data connections feature, which pulls information from patient portals, we don't currently grab scans or notes, though that is something that we're in the process of developing now. So the first thing that you'll see once we get to that point of releasing that development or feature is the ability to pull over doctor's notes. And then we will be able to pull scans eventually as well.
Okay. So Kathleen is also asking, how is Backpack different from Epic?
Good question. So Backpack, and I'll put it more so as, how is Backpack different than a patient portal, as Epic kind of feeds into the patient portal. And a typical patient portal gives you the access to your data and you're able to see it. The difference is that Backpack allows you to then take that data and add additional details if you need to, but more importantly, share it with anybody that you need to. So it's easy to not only take that information and view it yourself, but then also get it to family members, providers, or in this circumstance, contribute it to the Marfan Foundation for the registry.
Mhm. And can you go over, is it all medical health systems that can transfer data into Backpack, or is it about 80% of them at this point?
Yeah, it's somewhere between 80 and 85%. But the good thing is that if we run into an issue where you can't find your health system in the data connections feature, it prompts our partner that we work with on this to establish that connection so that we can then notify you that that system is now a part of the data connections feature. So even if you can't find it right now, we'll work to get that health system incorporated in data connection.
Oh, that's great. So somebody is asking about how do they register. So we will put that in the chat box so that everybody has access to that. Let me look to see if there are further questions. One of the things I wanted to make known as well is that, the Marfan Foundation wanted this service, one, to help you keep track of your health history and always have it available to you at all times. But additionally, we wanted to utilize it to get more evidence-based type of research, real world experience. And that's why we are launching all of these types of surveys so that we can get a better understanding of what the actual evidence or what patients really how they are affected by certain different things. So as Michael said, the first one is pain and neurolactasia and headaches. We know that it's a big part of the Marfan population, but we don't have good statistics on it. And so by answering these questions, you will help us gain that information. So let me see if any other questions are coming in or in the chat box.
And Joe, I'll just add to what you said about the new survey series, that they will be opened but then closed at a certain point. So I encourage everybody to go in and take that first back pain questionnaire so that we can get as many responses as possible.
And I think it's really also important for us to understand, Backpack is available for many of the related conditions. So we really want to know what condition that you're diagnosed with and how you were diagnosed. And I think that initial onboarding survey asks a lot of questions about that, but it will help us on the research end of it to utilize any evidence-based data based on your specific diagnosis. So this question is asked by Charlotte. Do you enter all types of medical appointments / doctors, primary care cardiologists, dental, eye doctors? So I'm not sure if she's asking whether Backpack does that. I think that's what she's asking. So can you go over that a bit?
Sure. So what you can do is there is an option to add or list your providers, and it's more so for your own reference. It's not information that would be shared through a survey, mostly because that would potentially identify a person if you share who that medical provider is. So we really provided that feature as a convenience through your profile to be able to add the different doctors, their contact information, so that you have all of that with your health information so you can easily access that. In addition, that information can be included on that emergency share card. So if you wanted to direct first responders to reach out to a specific provider, you could provide that contact information right there on the card.
Okay. This is asked by Christy. Is the patient registry international or US only?
So it is international. Backpack itself is compliant with all privacy policies globally. And the goal in partnering with the Marfan Foundation was to really launch this international patient registry. So that is the reason why we comply with global privacy standards, but also the reason why we are multilingual and continue to add more languages.
Mm-hmm. So this is asked by Charlotte. You also mentioned that you can enter information for elderly parents as well. And so why don't you talk about the whole family dynamic and how people can be grouped in an account?
Sure. Yeah, the idea was to really create a family-based tool. So if you are the primary person in the family who's managing all this health information, you can create a backpack account for yourself, and maybe you're not really tracking your health, but it's more so about tracking elderly parents' health or your kids' health. And so by creating an account, you can also add dependent profiles to that account. So you're not creating multiple accounts and logging in and out of all of these accounts. Everything lives within one account, and then you have these dependent profiles where you can easily switch back and forth between different family members to be able to add information to their profile. And that also works for if you have kids who are underage and they want to, and you want them to be a part of the registry, you can sign them up through the app and then answer questions or contribute information for them.
Mm-hmm. And is there an age limit for kids when they can start utilizing the backpack app themselves?
Yes, so once they reach the age of 13, they will have the option to take on the account themselves. And so we have a process in place that makes it really easy for them to create an account, and then all the information from their profile will be used to populate that account. It's not a requirement that they take over at 13. If the parents and the child wants to have the parents continue to manage that information, they can continue to do that.
Mm-hmm. But can the child, without managing it, have it on their phone and accessible for them? So like if they're in school or someplace and something happens, they have access to their account?
Yes, absolutely.
Let me see, I don't see any other questions here, or maybe one. Does anybody else have any other questions? Let me see how many people. We have 28 people on the call at this point. Can you tell us, Michael, about a little bit about ease of use of the app?
Sure, and I do see one more that came in, but I will talk about that first. So when we developed the app, for the first year before it was available to patients, we worked with rare disease patient populations to really understand what their needs were and to make this as patient friendly as we could. So what you're seeing is really driven by patient feedback and really being able to beta test this product so that we could really truly make it patient driven. And that's always going to be the case for us. When we decide the features we want to build out or how we're going to improve the app, that comes from patient feedback, user feedback. And we did try and make it as user-friendly as possible, making it available on iOS, Android, and web. So really whatever device you're comfortable using, it functions in the same way across all different platforms.
Okay. So I think, yes, somebody else. So this is asked by Melissa. Would the child then have their own code for an ID bracelet?
Yes, so they would. So you would have a dependent profile for your child, and they would have their own emergency card. And so you would decide what information from that dependent profile you want to add to that emergency card. And that emergency card itself has its own unique URL and access code that you would then engrave on your child's medical ID bracelet.
And is there any partnerships with medical ID bracelet companies?
Yes, so we do currently have a partnership with a company called Sticky Jewelry, or Sticky J, and they do offer a discount to the Marfan community. So I definitely encourage taking a look, and we make it really easy. So if you actually just get started on the app and then you go into the emergency share card, you'll see a little spot where it says add medical ID bracelet, and that'll give you the option to go visit their site and see which bracelets are eligible to be compatible with Backpack.
Oh, that's great to know. I think we have another one asked by Charlotte. Does it also work through the Apple Watch? So if you can put apps on your phone, does it work on an Apple Watch as well?
Good question. So we don't currently have an Apple Watch version of the app, although it is something that I know has been talked about by our engineers and product team. I don't know when that will be coming. I think that, we're focused on really continuing to build out the mobile functionality of it. But I do know that that's something that they plan on tackling at a certain point in the future.
And how about other like tracking devices, for your, say, heart rate, your Fitbit? Are those things that can gather data and be stored in Backpack?
So that's also in development. And it's something that we approach kind of on a case-by-case basis. So there are so many different wearables out there. And so we work with the partnerships that we have with foundations to identify those wearables that the community is largely using so that we can establish that data connection to be able to bring in that data. So it's something where if there's a need that comes up, then we're certainly going to explore being able to do that. And when we built Backpack, we really built the framework to have that functionality to be able to identify those wearables to bring in that data as well.
Okay, great. So let me see here. We have 27 people on the call. Does anybody else have any other questions? I'm not seeing anything coming in at this point. So you want to tell us a little bit about the chat feature and help feature in Backpack again?
Sure. So as I said before, everything that we do is really patient-driven or user-driven. And so we have a team dedicated to providing support. So if there are questions because there's an issue with using the app or you can't find certain features and functionality within the app itself, you'll be able to access the help chat. But we also have a help center which has tutorials, videos that walk through specific features and then frequently asked questions. We try to, as much as we can, have 24/7 coverage of that help center so that if somebody has an issue, they can reach out and we'll get back to you as soon as we can. But also, in addition, if you have suggestions for features that you'd like to see, we strongly encourage that you reach out, chat with us, or send us an email at help@backpackhealth.com to let us know what those features are. Because again, that's how we're able to really successfully build this out so that it's functional for everybody that's using it.
Mhm, mhm. And can you talk a little bit about how the app is organized by types of data? So there is a tab for measurements, there's a tab for lab tests, there's a tab, and maybe some helpful hints about how to organize certain documents, like if you want to scan documents into the app.
Sure. Yeah. And so, as Joe was saying, everything is very categorized so that we can keep everything organized for patients and make it easier. So when you go to add information, you'll see conditions, symptoms, medications, lab results, test results, genetic testing results, so that you can go in and easily find the information or the category to add that information to your profile. You can attach files to your general profile, but what I always encourage people to do is, if you're adding, for instance, that you had a CT done, so a procedure, you're adding CT, the date, the details, you can actually upload or attach the image of the CT directly to that profile entry item. So it really does keep it organized because it's assigned directly to that information that you've added additional to that imagery. But you can also at any time, if you had a PDF you wanted to attach or anything just generally to your profile, it's really easy to do that as well.
Mm-hmm. That's great to know. So let me see, there's another question here that came down. I keep track of my nitrogen pulse and weight. I guess that's nitrogen, NO. Can I record this info in Backpack?
Yes, you can. So that would be something that you would record as a measurement in Backpack. And again, one of the newer features is the ability to see that visually over time. So if I'm tracking my weight over the span of 6 months, I will see that over time. Each month, it's going to list the different data points that I've entered. But in addition, on our next release, which will be coming in the next month, we'll be able to offer the ability to have a symptom tracker. So things like pain, for instance, if you want to track that, we'll essentially be prompting you to add what is your level of pain today, so that over time, again, you're going to be tracking that level of pain, and then visually you'll be able to see what were my levels of pain over the last 3 months. So we make it very easy for you to track measurements and symptoms in that way.
Mm-hmm, mm-hmm. That's great. Thank you. I don't think I saw any other questions come in right now. Yep, we have another one. Hold on. This is asked by Yvonne. Do we need to get the copies of imaging, for example, CT scans, X-rays, or MRIs to upload them to Backpack, or can our providers add it in for us? Good
question. So providers don't have access to your Backpack profile. So it is something that you would have to upload as the patient. So the best way to do that is to get copies of the images so that you can then upload it and keep it organized within your Backpack profile. As I said, in the future, we do plan on having the functionality to bring over that imagery from your patient portal, so through the data connection. That's not something you can currently do, but that is something that we're going to be developing in the future to make it easier for you to bring that over as opposed to having to manually upload them to your profile. Mm-hmm, mm-hmm.
Yeah, that would be great, especially to keep track of aortic root measurements and any other aneurysm measurements that affect this community. So, those are extremely important.
Absolutely.
So let's see, with repeat tests, can Backpack organize and graph the results from each test?
So you will be able to see with each test that you're entering, it will categorize it per test. So we don't yet have the functionality for you to visualize the tests over time, but similar to the measurements, that will be coming. So we started with measurements, next will be the symptom tracker, and then we're going to kind of expand from there so that if you are having the same test done, over, again, the span of, let's say, 6 months, that you'll be able to visualize the results of that test over the span of those 6 months.
Mm-hmm. Mm-hmm. Okay, great. So can others who aren't part of the Marfan community also use Backpack for their medical information, muscular dystrophy, or a regular health person?
Yes, absolutely. The idea behind Backpack was to create a tool that anybody could use, and then we build out these specific communities that are a part of Backpack. So the Marfan registry is a part of Backpack, but we have many users who are not a part of the Marfan registry and are using it for either tracking their own health, or they're a member of a completely different registry unrelated to Marfan and related conditions. So absolutely, the app is for anybody and everybody. We encourage not only those who are taking part in the registry to sign up, but also family members who might be using it for emergency information or just to keep track of their information.
And there are a number of other organizations that have registries within Backpack. So if you have somebody in your family that may have one of those other disorders that are included in Backpack, I mean, you can be part, that person can be part of one community, whereas another person in the family can be part of another community. Is that correct?
Exactly. Yeah. And the nice thing is that you might find that as you start using Backpack along the way, we're developing additional partnerships and launching other registries. And so you might find one that is relevant for you or for a family member. For instance, you may have come to Backpack to join the Marfan registry, but we also have an allergy and asthma network, which is another patient foundation, and they have a registry as well. And many in the community may have a food allergy or may have asthma, and then it's easy to join that registry as well to take part in that or learn about a new community and benefit from the resources that you'll receive from that specific community.
Mm-hmm. And how does it work with the household account? It's still okay if the parent doesn't have the disorder, but the child has the disorder. Is the parent part of the Marfan registry and the child, but they can also, how does that work?
So if, let's say, the parent doesn't have Marfan syndrome, but the child does, the way that it works is you're able to add or have that dependent profile join the registry. So it's not that the parent has to join even though he or she may not have Marfan or related conditions. You're able to just join the dependent profile to the registry. And then if it is a child, you can answer the questions, participate in the survey, and get the information over to populate the registry.
Great. So this is asked by Mary. How would first responders be able to access data in an ER setting or situation? Is this possible? If the patient is unconscious or an aortic or heart issue happens?
Yeah, so absolutely. And that's really the goal, is to be able to make it easier for first responders, not only in an ER setting, but any sort of situation, to be able to access that information. So by having that URL and access code on the lock screen of your phone or engraved on a medical ID bracelet, they're trained to look at that information and then go to that website, enter the access code, and see that information. And the benefit really is that by partnering with the foundation, they've provided emergency care instructions. So there's emergency care instructions for VEDS patients, Marfan patients, and other related conditions, so that if first responders have never come across a patient with Marfan syndrome, because it is a rare condition, they'll be guided by the information that the foundation has provided that is given to you to be able to provide or include on that emergency share card.
Great, thank you. Will, this is asked by Lori, will I be able to print any of this information out? I'm not really sure which she's talking about, but I'm assuming that's the information within the app that she puts in there.
Yeah, so you can. The best way to do that is if, let's say, you wanted to print out your entire profile information, you could use the health history share card, which allows you to essentially add all the information from your profile to that health history share card. And then you would create a PDF and you can print that out. So it is very easy to print out essentially a record of the information on your profile.
Mm-hmm. And I think that's great for attaching it to, you know, at the beginning of schools. Schools are now, some of them are opening to just attach that health history form with all the important contact information to the information that your school requires when your child has to submit their health profile.
Absolutely. And also, if schools are open to this, some will be, some will not, but one of the benefits is that you can create a share card for your child for the school nurse. And that share card can be updated throughout the school year with additional information that you add along the way. And that school nurse will have access to the information through that URL and access code. You know, as I said, some nurses will have the capacity to go to a website to view that information, some won't. But at least you can easily share that information that way, or as Joe said, create a PDF, and if need be, provide updated copies of that PDF.
That's great. So this is asked by Melissa. Are there options for bracelets? She says she's allergic to metal.
Yeah, definitely. So Sticky J offers many different types of materials. So they have the kind of standard silicone bracelet, which can be used to be able to get the information on there. So I definitely encourage visiting their site. Again, you can access it through the app. You'll see that on the emergency share card itself. But there are a lot of options, so they can cater to allergies, such as allergies to metal.
Great. This is asked by Mary. Is there a fee or membership dues?
So good question. Backpack is entirely free. And so there will never be a fee or charge to use the app. That includes in the future as we start to add additional functionality. You know, our mission is to provide this service to patients without adding to the already, you know, high burden of cost of medical care. So this is entirely free to patients and their families who can add as many dependent profiles, have as many share cards, and there will never be a fee for that.
That's really great. I mean, I think it's a great service for those that have a chronic disorder. I think it's helpful to have all the information in one place and accessible at all times. Do you want to go over a little bit about, well, even though travel is come really to a halt at this point, but if somebody was traveling, for example, to Europe, how would having their information on Backpack Health on the app help them?
Yeah, so, you know, being able to get the essential information that, you know, I've been to a number of the foundation's conferences now and spoken to a lot of patients. And what I think is very encouraging is that some of the community members that I've spoken with, you know, are very nervous about traveling with a rare condition that is not known to everybody and not known to all first responders, not only within the country they live in, but then as you travel overseas, there's even less guarantee that they will know. And so, you know, being able to create an emergency share card and have that essential information has given them a sense of comfort to know that they can travel now and feel safe because they have that information. They're able to easily translate it, or it already is translated into the 6 different languages that we offer. so that you can know that you're getting the essential information to those first responders so that they understand what's going on with that patient.
Mhm. And can you also explain how you do not need to have internet accessibility in order to get information in case you're in a part of the country that you don't have internet for?
Yeah. So, and that's an important detail as well. The information that you are adding to that emergency share card or to your profile is stored locally on your phone, so that if you don't have access to the internet, you can still go into your profile and you'll be able to see that information so that you can show that information to somebody to make sure that they can view the essential information that they need.
Mhm, mhm. Yeah, and I think that is really key, because in many places you can be without internet access.
Absolutely.
Mhm. Does anybody else have any questions at this point? I don't see anything else coming in right now. So I think we'll go ahead and wrap it up, but I want to thank Michael for his time in explaining the app. I think it's a great service to our population, not only for Marfan, but for anybody that wants to keep track of any health issue that they have. So just some final thoughts tonight. If your questions weren't answered, you can submit them to on our website at marfan.org/E3ask. I think Michael said he will still take a look at the chat and Q&A box in the session. So if you want to ask questions there directly of him, he will be able to answer any questions that you would like. We would hope that you would complete the session survey and let us know what you thought. Visit our exhibitors in our virtual exhibit hall, and please, connect with the community. There are many people within the app. You can do that directly from the app. If you are on social media, you can use the hashtag E3Summit20 and, share information and let us know how you enjoyed the summit. And if you're interested in helping making programming more possible for us, or you can donate at marfan.org/donate. So one last thing before we end, I just want to bring everybody's attention that Aortic Disease Awareness Week will be September 19th through the 26th. This is a global event, and it's powered by the Marfan Foundation. And we would really hope that you would be involved in some of our awareness projects by raising your hands for awareness of the risk factors for aortic disease. So information about this is available on the app, on our website, and in social media. So Michael, do you want to provide any final comments before we end the session?
I just want to say thanks again for inviting me to speak. Again, this is a great program, and I'm very happy to be involved. In addition to questions that you put into the chat, you can always reach me personally at michael@backpackhealth.com. Feel free to reach out directly to me or to help@backpackhealth.com. As I said, we'll quickly answer questions, or if you just want to learn more about the app and you want help getting started, we're happy to walk you through that process as well. And we hope that we can get as many people as we can to sign up to join the registry and participate in the surveys. And I'm very happy to help do that.
Okay, thanks so much. So thank you, everybody. I hope everybody has a good night. Thank you.
Thanks, everyone.